All right, so today I want to talk about making empowered medical decisions for yourself. Not blindly following what the doctor says or what the science says, but something that you feel like you've made the choice yourself. And this could be after your trust has already been shattered or broken, or even if it hasn't. I can't tell you how many people I know that go to the doctor, follow all the orders, right? They go regularly like they're told. They do what the doctor tells them. They take all the prescriptions, but then they say things like, "Oh, I really hate going. I hate going there because the doctor makes me take these pills that give me headaches. They say I need the flu shot every year, but then I feel so crummy for days and I still get the flu while my neighbor never takes the flu shot and they haven't had the flu in 10 years." And things like that, but they still keep going and they still follow the orders and they don't question anything. A lot of people don't question, right? Even if they feel uneasy about the interventions they're given and the medications they're prescribed or the side effects, some of them don't even ask about the side effects. They're just told, oh, it's normal, and they accept it as that's just how it is. They don't wonder what happens 10 years down the line. And of course, it could be because many of us grew up being told, trust the doctor. They know best. They're the ones who go to school for many years, that study the science for years, and they give us the right answers. Why wouldn't we listen to them? They're the experts. But then many of us come to a place where they realize they were right all along. And that can change everything in your life, right? Because you might actually end up with permanent side effects of something, or you might get hurt. And you knew that could happen. Somehow your gut was telling you this is not the right choice. So now there are cracks in your self-trust. You might even lose trust in the medical system or in your doctor. And it becomes an overwhelming task to navigate the system after it's hurt you or after it has given you advice that proved to be wrong. And now you're suffering with some side effects. And yes, of course, science is valuable. We all know that it's brought us breakthroughs and great treatments. I'm not denying that at all. But let's also look at the dark side of science, right? This science can be corrupted. A lot of it has been corrupted. There's ghost-written research papers. How is it legal that ghostwriters write papers? And most doctors don't even know about this. There are industry-funded studies with predetermined outcomes, financial incentives quietly steering recommendations. And you can research all of this yourself, and I would really recommend you do. All this is public information online. And these are not rare exceptions. This is now increasingly common. And of course, I'm not saying that all doctors are bad, nurses are bad. In fact, the opposite. There is many, many wonderful, compassionate, kind doctors and nurses who truly care, who truly listen to you, and who fight, in fact, who fight the same battles against bureaucracy and greed like you and I. They face challenges navigating the system to take care of us in the best way possible. But for us, patients, the challenge is knowing the difference, right? How do you know that the doctor you're seeing is the good one? And how do you know it's the one who's just following the check boxes and doesn't even think otherwise, doesn't disclose all the risks, or doesn't even know all the side effects of the medications that they're prescribing you, right? Because they don't always know. And so when you're making an empowered health decision, I think it comes down to discernment and knowledge. I think discernment and knowledge are your lifelines. So basically that comes down to your intuition, trusting your intuition, knowing how to listen to your gut, and knowing you don't have to abandon the entire medical establishment. You can make it work for you the way it was always meant to. And a lot of times it's trial and error and making mistakes. You make one decision and then you think, oh, maybe I should have made a different one. Maybe I'll just go back and take the prescription after all. You can correct that. There's no shame in that. Or maybe you do get on a prescription that you weren't really sure. You thought, okay, I'll just try it. And then you decide, yeah, it's not really for me. And you stop the prescription or talk to your doctor about how to stop the prescription safely. And that is your decision to do. If I use myself an example, so I was harmed 13 years ago. And even for a few years, as I was figuring out answers, for a few years after that, I agreed to many procedures I instantly regretted, right? I still felt bad declining things. I still wasn't confident. I didn't want to be labeled as non-compliant, the non-compliant patient. I even worried being kicked out of the hospital for refusing, because they would figure, well, why are you here then if you refuse? And I didn't want to be thought of as difficult, or even flagged in the electronic medical system as someone who refuses treatment or who's a difficult patient. And that's a thing, by the way. It took me years to reach a place of real, true self-empowerment, where I could confidently decline diagnostics or prescriptions that I knew would not help me heal. Because I did the research, I should listen to my intuition, and I made the choice. And of course, I encounter judgment in the exam rooms many times, and it doesn't shake me anymore. If the doctor sees me as non-compliant or wrong, I'm totally fine with that. I'm also okay knowing that refusing certain tests could mean missing something. And I've made peace with that as well. Because in the things that I refuse, I know that the harm to me is greater than the risk of refusing the intervention. I've just become good at doing the benefit risk ratio for myself. Yes, I do a lot of independent research. I also listen to what the doctor tells me. I listen to everything, and then I go read about it, and I find the side effects and the risks. And if there are side effects that I worry about and the doctor never mentioned, I ask them about it. So I go back and forth, and I talk to people who have had the same interventions, who have taken the same medicines. I get the good, the bad, and the ugly, and then I make my own choice, even if it's the opposite of what the doctor says, right? I consult my intuition, I spend time with it, I sit with the information, and then I make an empowered choice. So where can you start to learn to make empowered choices for yourself, right? So let's look at some red flags and then green flags. So for example, if you go for your appointments with the doctor, here are some red flags that I usually watch out for. Being rushed through appointments. We know that there are appointments that are like 2, 3, 4, 5 minutes, and then you have to get out and there's a next patient behind you. If you feel rushed, if you feel like you haven't had a chance to ask all your questions, that your questions weren't fully answered, if your concerns have been dismissed, let's say you go back to a doctor asking about a side effect that you researched, or maybe a severe complication of a surgery you're supposed to have that somebody had, and now you're worried about you having it. If they dismiss that concern, that's a red flag. If they tell you, oh, it's not going to happen to you, that's just conspiracy theory, that's just 1 in a million, it's rare, or it doesn't even exist and the patient's made it up. If they dismiss you, that's a red flag. If you come to the doctor with concerns, like you know something happened to you, something's wrong, some medication's making you feel bad, you're worried about bad outcome, and the doctor makes you feel like, oh, it's not the medication. It's you. It's stress. You're getting older. It's your hormones. This is all normal. It has nothing to do with the medication. That's a red flag, right? They should address the concern that you have. They should address the side effect that you researched, and they should take you seriously, If you feel pressured into taking certain medication or having a certain procedure, that's a red flag. You should not feel pressured. If you feel like you didn't get all the risk benefits, that you maybe only got the benefits and the risks were downplayed, but yet there's something. If they tell you, hey, stop using Dr. Google, there's so much wrong information out there, that's actually a red flag, because you should be able to search things on Google. You should be able to use AI to ask questions, and you should be able to double check and triple check and cross check and read the mainstream research and read the non-mainstream research and speak to people, and then bring the questions to your doctor. If they dismiss it and tell you, do not read Dr. Google, like don't even come to me if you get your answers from AI, you might want to find a different doctor who will be open to all this. I mean, this is not uncommon, and doctors should be used to it by now, that that a lot of patients do their own research. So if they dismiss you, that's a red flag. So now to the green flags. So of course, green flag would be kind of the opposites of what I just mentioned. So somebody who truly listens to you and your concerns, who hears you out, who does not dismiss you and what you bring to the table, that does not laugh at you about Dr. Google, somebody who has honest conversations about all risks, all benefits, and alternatives, somebody who collaborates with you instead of dictates what you should do, or orders you what to do, or just writes you prescription and sends you on your way. So they're okay with what you've read in the internet, you ask them the questions, and they have the conversation with you. That's green flags. Discernment and independent research and knowledge is not about mistrusting everyone, not at all. It's about knowing the difference between being cared for and being managed. And, we live in a culture here in the US that glorifies data and constantly promotes so-called evidence-based practice, right? Evidence-based medicine based on research and science. And while it all sounds great, it also ignores the hard truth that a lot of science has been deeply corrupted over time now. And I mentioned that a little bit ago about ghostwriting and predetermined outcomes, right? And paying off doctors and pharma-funded studies. And hiding side effects from trial, minimizing side effects. So a lot of times, even your doctor doesn't know about the real risks of medications and procedures. A lot of doctors have never heard of ghostwriting. And some of them will even deny it's happening, even if you show them that it's happening. Our own knowing is not irrational, right? It's the most valuable tool you have. When you're faced with a non-emergent decision, and I am saying non-emergent on purpose here, because if you find yourself in an emergency, like you were in a car accident, you were brought to the emergency room, or you had a heart attack or a stroke and you were brought to the emergency room, you might not be in a place to make a truly, informed and a self-empowered decision in a moment like this. It might have to be your family making it for you, or you just kind of do have to hand over the control to the staff in the emergency room. So I'm going to leave emergent out of it. The only thing I'm going to say about emergent decisions, health decisions in an emergency, is that once you cultivate non-emergent medical decisions and you are making self-empowered medical decisions, even in an emergency, you will be better equipped to make a decision. Even in a situation where it's rushed, you will be better equipped because you will have had all this time to practice self-empowered decisions. You've gone through the trial and error and you've cultivated that. You're going to be able to make a better decision than if you have never done that. So if you're making a non-emergent decision about taking a prescription or having a procedure, you take your time, you sit with all the information you researched and received, and you ask yourself, does this feel true? Does this resonate deeply within me? Do I feel seen and heard? What is my gut telling me? Am I choosing out of fear or out of clarity? Am I at peace with the consequences of saying yes or saying no? And when you arrive to your decision and where you feel like you've done all the work and taken the time, then you have your answer. And sometimes your answer might not make sense to anyone else but you, and that's okay. Because you are the one who is going to live with the outcomes and the consequences, not the doctor, not the nurse practitioner, not the PA, not the scientist in the lab, nobody but you. Every choice carries uncertainty and risk, of course. Even the most carefully researched decision can lead us to surprises years later, right? For example, there could be someone who decided to get breast implants in their 20s or 30s, and it felt like the most empowered decision they could make at the time, and they feel like they've done all the research they could do around this. But then years later, they might find themselves with developing breast implant illness, autoimmune issues, and brain fog as a result of the implants. No one's warned them about this maybe, or maybe if they had, they still chose to do it. And that's fine, that was their choice. There might be someone who refuses chemotherapy for cancer treatment, believing that it's the right choice for them. And that's also okay. And we should never make people feel guilty about that, because guess what? Chemotherapy carries a risk. It can be a big risk, permanent damage to your health, or it can even kill some people. So I do think that we need to stop the culture of blame and guilt over the decisions that people make. But my question always is, are we truly informed? Are we given informed consent with every known risk clearly explained? The goal isn't perfection when you're making decisions for yourself. It's peace. It's being able to look back and say, I made this choice with all the information I had. I took the time to research it, and I made the choice from a place of clarity and not fear. And for example, for me, that's meant refusing MRIs that I was told to have. I've refused mammograms. And I said no to tons of prescriptions that I was told I should try, because I did my research. I researched all the side effects. And I uncovered buried trial data many times showing low to no efficacy to these drugs whatsoever, and many times a risk profile far above the acceptable level for me personally. I do not make these choices lightly at all. I weigh all my options. I weigh all the evidence. I listen to my body, to my intuition, and I honor my boundaries. And if I choose to change my mind, I give myself a permission to do that. And that's okay. And your path might look completely different, and that's the whole point, right? There is no one size fits all medicine. The standardized protocols do not fit everyone, and no one should be made to feel bad or non-compliant or stupid or told they're conspiracy theorists, or that they listen to conspiracy theorists, or that they should stop researching online. Self-empowered choice is just that, right? It's a choice. We will live with the consequences, and we can change our mind if we need to. So before your next health decision that you have to make, whether it's as small as changing a supplement or as big as scheduling a major surgery, I again invite you to pause and take a step back and sit with it. Sit with all the information in a quiet place and listen what's beneath the noise of the thoughts and the chaos of the emotions around this. Let your knowing rise to the surface, and mainly take as much time as you need. Don't feel rushed. Because no matter how broken the system feels, and no matter how loud the outside voices are, you still have agency. Always. It's your health, right? It's your body. It's your choice. It's your life. You are the one who will live with the consequences of that decision. That brings me to the end of my video today. If you enjoyed it, feel free to share it and subscribe. Feel free to ask me any questions. And I do provide medical harm prevention and recovery coaching. If you are interested in finding more about that, it's at my website at chironhealthcoach.com.